Neuropathy. What is neuropathy? It is caused by the deterioration of the nerves that lead to the ends of the limbs, hands and feet. This makes it impossible for the body and spinal column to communicate with the muscles, bone and other tissue that makes up the upper and lower extremity. The peripheral nervous system is the body's electrical wiring system. Any disruption in this system will cause foot pain symptoms such as burning, tingling, numbness, itchiness, and occasional shooting pains all the way to unremitting pain. Peripheral neuropathy can be caused by disease, nerve compression, nerve entrapment, laceration of a nerve through trauma or surgery, exposure to toxins, and inflammation. In many cases, especially in people over the age of 60, no cause can be determined. Early intervention is very important in treating neuropathy. Identifying the source of the neuropathy and rectifying the problem, if possible, will go a long way to eliminating the worst cases of neuropathy. Some of the more common medications known to cause neuropathy include statin drugs, colchicine, allopurinol, Taxol, a chemotherapeutic agent for ovarian and breast cancer, amiodarone, an antiarrhythmic drug, some antibiotics, and even thalidomide, which has come back into vogue for treatment of HIV-related ulcers. Other causes of neuropathy include alcoholism, metabolic disorders, autoimmune disorder, cancer, chronic kidney failure, rheumatoid arthritis, infectious disease such as Lyme disease, vitamin deficiencies, liver failure, radiculopathy, diabetes. Diagnosing neuropathy. Finding an exact cause of neuropathy can be very difficult, if not impossible, in many cases. Tools that are available in trying to isolate the cause include the following: proper medical history, type of symptoms, location, either one limb or both limbs. If the symptoms are occurring equally in both feet, a systemic cause should be investigated. If only one foot is involved, then investigation should be geared toward conditions such as radiculopathy, trauma, and nerve entrapments. Lab work, blood tests can be helpful in identifying or eliminating possible causes. A hemoglobin A1C reflects a person's average blood sugar over a period of 3 months. If this is elevated, diabetes has to be ruled out as a source. A complete blood count, CBC, should be performed to rule out anemia as the culprit. Nutritional testing may be considered to rule out vitamin B and vitamin D deficiencies. Testing for elevated levels of heavy metals, lead, mercury, copper, zinc, chromium, as well as Lyme titer can be useful. These tests are especially helpful if the doctor suspects a nerve entrapment. Diagnostic testing. The standard tests over the years has been nerve conduction studies, which essentially looks for a break in the conduction capacity of a nerve. This test offers little help in diagnosing neuropathy associated with systemic causes. Treatment of neuropathy. Treatment is geared to finding the cause of the neuropathy. As stated earlier, many causes of neuropathy cannot be remedied, so treatment becomes symptomatic. Treatment options for reducing pain include physical therapy. This is usually reserved for neuropathy involving one limb as a result of nerve compression or nerve entrapment. Injection therapy. In the foot, at least, injection of steroids is indicated for local entrapment of nerves. Surgical intervention, tarsal tunnel, decompression, spinal surgery. Oral medication. Cymbalta is an FDA-approved medication for neuropathy. Neurontin, although not FDA-approved, is an off-label use for neuropathy. Lyrica is another oral medication usually best served in diabetic neuropathy. Medinx, a prescription medication, is a combination of folate and vitamin B components which has been shown to be effective in treating diabetic neuropathy. A topical preparation called capsaicin has been used with some degree of success. Made from a pepper derivative, when applied topically to the affected area a few times a day, over the course of a few weeks, many patients begin to feel a reduction in their symptoms. Read the complete article at www.foot-pain-explained.com/neuropathy.html